This is Dr. Matthews, and this discussion is about the respiratory system. For respiratory infection to occur due to an exogenous agent, a sufficient dose or number of infectious agents have to be inhaled. That's why it's a big difference being in a crowded bar than being outdoors, because you get a lot more germs where people are just sharing air and breathing each other's air and being up in each other's faces. Infectious agents need to be airborne or contained in a droplet nuclei. The organism must remain alive and viable while in the air. Now, with a virus, it's not technically alive, but it's still viable, it's still usable. And it must find susceptible tissue in the host that will allow it to attach and grow. And once it's in the respiratory tract, it colonizes surfaces of the respiratory tract before it causes disease. This is a picture with an overview of the respiratory system with your upper and respiratory system, larynx, and then your trachea, and it bifurcates and goes out to the two lungs. Here's your bronchi, and then they break into smaller and smaller branches until you finally have your alveoli. This is alveoli and capillaries. The difference in bronchitis and pneumonia is that with bronchitis, you just have the bronchioles infected, with where pneumonia, it's actually out in the alveoli and can cause parts of lungs to collapse. Strep throat or streptococcal pharyngitis, generally caused by group A strep, and it's the most common bacterial infection of the throat. Can occur at any age, but most common in children, and transmission is from person-to-person contact. And this is showing Streptococcus pyogenes. Scarlet fever is caused by a group A beta hemolytic strep. Again, the Streptococcus pyogenes looks just the same, but this is one that produces a toxin, an exotoxin. Starts with just a sore throat and fever, but then you go to chills, vomiting, abdominal pain, and the tongue gets a strawberry appearance to it, and this is going to require antibiotic treatment. The tongue looks all bad there, right in here. Streptococcus pneumoniae is, of course, gram-positive. If strep is going to be gram-positive. If it's Diplococcus, and it's also called pneumococcus. Common mild cause of respiratory illness, also a source for pneumonia though. So you could get a little small mild infection, or you could get pneumonia. Common inhabitant of the nasopharynx of healthy people, and it can go to the eustachian tubes and cause them to plug up, and then you get an ear infection, plug up the nasal sinuses, you can get pneumonia. This is, again, person-to-person contact. And the highest risk is very old, very young, and people who have chronic conditions, medical conditions, or they're immunocompromised. And there is a vaccine available that is given to people 65 or older, and for anybody who has some sort of immunocompromised situation. And there's a picture, you can see the little strep things, and that's a close-up. Drug-resistant Streptococcus pneumoniae, that's a little more of a problem because it's harder to treat. And a contributing factor is going to be overuse of antimicrobial drugs. You have a lot of outbreaks in nursing homes, child care centers, institutions where HIV-infected people are treated. And there is a pneumococcal conjugate vaccine available. Again, should be vaccinated if you're in one of these categories that needs it. Mycoplasma pneumoniae. This is an atypical pneumonia, usually young people, and it's respiratory droplets from person to person in crowded areas. Again, we're back to bars, dorms, anywhere people crowd together. This is showing a close-up of the Mycoplasma pneumoniae. Chlamydia pneumoniae is a major cause of pneumonia and bronchitis. Respiratory secretions are how you get it, and generally school-age children, and it is passed from one person to another, so it's a community-acquired pneumonia. Pertussis, or whooping cough, is the next we're going to talk about. This is not just for children anymore. People who weren't vaccinated as children can still get it, and this comes, I believe this is in your tetanus shot if you get the right one, and that's given every 10 years, so you're good for that if you've been vaccinated. It's caused by Bordetella pertussis. It can cause permanent disability and death, and person-to-person transmission. It's a bad thing, and my dad had it before there were antibiotics or vaccines, and the doctor advised them to lay him in the bed and let him die because there was nothing they could do. And his grandfather sat up with him around the clock, and when he'd start coughing half to death, he'd pat him on the back and even turned him upside down, cleared his throat, however he could do, and he lived, and here we are. So I'm very glad of that. He liked his grandpa. Here's some pictures of the Bordetella pertussis. Tuberculosis, Mycoplasma tuberculosis. It's transmitted through the air, affected person coughs, sneezes, or talks. Now, this is one of those diseases that was considered to be gone, but it's making a bit of a comeback. There's still not a lot of it, but there is some of it in the United States, and every now and then there'll be one, around Griffin or Thomaston, and it is mandatory that you get treatment. There was a man that refused in Thomaston. He refused to get treatment. He was ordered by the court to get treatment, and so they put him in jail for contempt of court, and they had to get guards to hold him, and the nurse came in and gave him shots every day for 9 months, I think, before it got him cleared up. There's also a test for this, a skin test, and sometimes if you've had a vaccine, like you were in the military or were in a foreign country, the vaccine could cause your test to come up with a false positive. 8 million people worldwide have active TB, and nearly 2 million people die. Fever, night sweats, loss of appetite. Some go into remission. Sometimes it becomes chronic, debilitating, goes on and on. There are vaccines, but they're not generally given. It's in areas where there's a lot of it, or if you're going to be in an area where there's a lot of it. And like I mentioned, it will give a false positive when you're tested later, which is inconvenient if you're in a job that requires TB testing. And there's a picture of the organism. Haemophilus influenzae, and it's a gram-negative Coccidioides, common cause of bronchitis. It can actually cause meningitis. And there it is in the lungs. Klebsiella pneumoniae. And again, we're into the rare, less common ones. Gram-negative encapsulated bacillus. These are often hospital-acquired, at risk people who are weak. Infants, old people, alcoholics, people with chronic disease. Can be up to 50% of fatality. Diphtheria, Corynebacterium diphtheriae. It's a facultative anaerobic gram-positive bacillus. Infects the nose and throat, upper respiratory system. Here's the big problem. It causes a pseudomembrane on the tonsils and throat and can cause a life-threatening respiratory obstruction. So without someone who can reach in there and get that membrane out, the child's going to sit there and choke to death. It also produces exotoxins, and it can affect the heart, and it's in a vaccine. It's given to kids when they're little. I think this is DPT. I think it's with the tetanus too. Corynebacterium diphtheriae. Legionellosis, Legionella pneumophila, gram-negative bacilli. Typical place that you get this is from inhalation of a water mist containing the organism. It has been in maybe one of the first times it was diagnosed and seen in a group of people was it was in an air conditioning system that was bad at a place where people were having a big meeting. Psittacosis. Unfortunately, I have very unfond memories of this because I actually got this. It's found in bird droppings, but it's in the air in an area where sick birds are. And I went to look at some sick birds at an aviary for a friend of mine, some kind of friend, and they had acquired a very inexpensive Indian ringneck parakeet, which they're really big birds. Parakeet sounds small, but they're big. But they had a bunch of baby birds that were sick and dying. They had, they had diarrhea, coughing, they wouldn't take their food, and then they'd die. I know there were lovebirds and cockatiels, little small birds. But anyway, I handled them, and within, I got home maybe 48 hours later. I got back to the school and had to go to the ER. Fever, chills, headache, muscle aches, dry cough, pneumonia, and it's not that easy to detect, and had no idea what it was to start with. And the doctor just happened to be in a tetracycline mood and put me on a tetracycline. Who would even dream of putting somebody on a tetracycline for pneumonia? But he did. The birds, we sent off tests at the state lab. They came back positive for chlamydia. The person was really mad that came back positive because then they were quarantined and couldn't sell birds. Well, I mean, who wants to sell a bird and then it gives the people a disease? But I obviously lived through it. I think I had 104.5 fever. I had a really bad headache. Okay, inhalation anthrax. You can tell I've never had this because I'm here talking. Bacillus anthracis, gram-positive, spore-forming, facultative anaerobe, spore-forming. That's the big thing. I think I mentioned in another section, you could bury a dead cow and come back in 50 years and dig her up, and the anthrax will still be there, though the cow's long gone. But it is naturally existing in some wild and domestic livestock like cattle and goats. You can get a skin infection, which if you catch it on time, you could live. Inhalation, not so good. Ingestion, not so good. Once the spores germinate, they start releasing toxin. Causes internal bleeding, swelling, and tissue necrosis. Very, very bad. I used to have a little saying that I said in class. I like abbreviations. Let's see. I can't draw too good with this. YGD. You gon' die. Anthrax is bad, and it was used as a bioweapon, sent in emails to some politicians, and the first few people died, and then they knew what it was and they got right on it if they got a letter, and all the letters were screened before they got to the politicians. I'd hate to be that screener. And here is a Bacillus anthracis, and this just looks like a little, you can see the endospore that didn't take this. See, I didn't take the stain. You'd have to stain that with an endospore stain. Q fever. It's called Q fever because it was a question. What caused it for many, many years? It is a zoonotic disease. You get it from livestock, sheep, goats, cattle, dogs, cats, birds, rodents, and ticks, especially rodents. But they finally discovered it's caused by Coxiella burnetii, gram-positive, spore-forming Coccobacillus. Not something too common here, but it is common in some of the developing countries. It's excreted in milk, urine, and feces. So don't drink unpasteurized milk or poo. It's resistant to heat, drying, and common disinfectant because of this right here, spore forming. Comes from humans inhale contaminated barnyard dust, or maybe they delivered a calf. Extract of infected herd animals, bite from infected ticks, and they'll have fever, headache, muscle pain, cough, chest pain, shortness of breath, and clay-colored stool. If you catch it early, antibiotics can treat it. Now, viral infection, 90% of respiratory infections are viral, and 50% of the lower respiratory infections start out at least as viral. There are many, many types of common colds, varieties that invade the nasopharynx, nose and throat. Last 3 to 5 days, sore throat, runny nose, can cause ear infections by stopping up the eustachian tubes. There's at least 200 different cold viruses, very contagious, but we get immune to the ones we've been around. No specific treatment, rest, fluids. And this is influenza, orthomyxovirus. RNA viruses, A, B, and C. This is person to person or by fomites, like handling something. I think about these pens in the doctor's office. They always want you to sign with a dirty pen. I keep thinking I need to take my own pen, but flu patients are also more susceptible to bacterial infections than healthy people. And occasionally there are new flu virus variants that result from antigenic changes, mutations. Here's a picture of a flu virus. Here's a RNA segments, and it's got spikes and capsids, and it is enveloped. Fever, headache, cough, sore throat, runny nose, muscle aches can cause gastrointestinal symptoms, more common that it's going to cause a respiratory, but you have epidemics every single fall and winter, and there is a vaccine. Before I got vaccines, I got flu every year, bronchitis, even pneumonia. I think I've had one case since I started getting vaccines, so I'm going to continue to get them. About half of all the viral pneumonias are caused, half of all pneumonias are caused by viruses. Flu, adenovirus, Coxsackie chickenpox, measles, cytomegalovirus, respiratory syncytial virus, RSV. And these tend to cause a non-productive cough, rhinitis, myalgia, headaches, and different viruses can cause different symptoms. Now, the latest and greatest one is COVID-19, and we're going to talk about this more under emerging infections. But there's been people being infected and buried from this stuff every day. So the vaccines are good. They're not going to kill you. I've had mine, and I would highly recommend that you get yours if you have not. Hantavirus. It's an interesting thing. It is very serious. 40% fatalities, acute respiratory symptoms. And it's carried by rodents. And you get transmission through contact with infected animals, urine, and their droppings. So say you decide to clean out an old barn or an old house that hasn't been inhabited in years, and it's full of rats, and you're cleaning it out. You could breathe that and get this. It's not very common, but it does happen, and it's very serious. Always talk about history with your patients, because if they say, oh, I cleaned out an old house that had a bunch of rats in it, then that might be on your rule-out list. SARS, this is a coronavirus. Person-to-person respiratory droplets, definitely life-threatening. High fever, body aches, dry cough, pneumonia. and they do have to have oxygen. Some of them had to be on vents. Not nearly as severe as its little brother coronavirus, COVID coronavirus. Histoplasmosis is a very interesting fungal infection of the respiratory tract. And this comes from inhalation of the immature fungus, and generally soil around old chicken houses, starling bird roosts, and bat caves. So if you're playing in cleaning out old chicken houses and starling roosts, we don't really have that many starling roosts or bat caves around here, but wear a mask. And wear a good mask, an N95. It's just worth doing. Histoplasmosis, most people don't even get sick with it, but you get fever, headache, non-productive cough, and it can cause severe disease in people who are old or immunocompromised. This is a section of lung. So this is the human tissues, these little tiny cells. These individual big dark purple things are the organisms. They're huge. You could probably get that from I don't know if y'all do transtracheal washes. We do these in horses where you put a little needle into the trachea and shoot saline in, and they cough and you suck the saline back out and you can find these organisms. Coccidiomycosis, Coccidioides immitis. Again, another fungal infection, and history is the thing. Have you traveled lately? Oh yes, I was in the southwestern United States digging for treasure. Desert soil, rodent burrows, archaeological remains, and mines is where people tend to get these. 60% aren't going to get sick at all. Some have mild symptoms, but some do get pretty bad symptoms, even coughing up blood. And they usually will get over it with just rest. But this is in the lung. Look at this. These are little normal lung cells. There's this like walled off thing here. Let's see if I can find my pointer. This walled off thing here. This is an individual human cell, and that's all these organisms. So if you were immunocompromised, say you had HIV or another, or were on immunosuppressants, that would be a bad disease to get. Blastomycosis, it is a blastomyces dermatitis, and it's inhalation, and it affects the lungs, can go to other areas, and this is from digging in the wood and soil. So like playing with old pieces of wood or digging in the soil. So I don't know if this is bad in gardeners or not. Generally, they don't need treatment unless if they get really sick or if infection spreads. But these organisms are huge. This is the human cell, and see, they've got that with look at that organism. That's scary. Okay, aspergillosis. Again, take your history. Mold found in decaying plants, stored hay, and I mean old hay, compost pile, old bird droppings, excess dust accumulations. So they clean out an old barn, and then they have this awful respiratory infection. You give them antibiotics and they don't get better. That's usually where it's going to start. They're going to treat them first. And this is what the organisms actually look like. So that's a pretty impressive organism. Well, that's all for now. Thank you.